All right, so this I hope will be a better position to demonstrate from. Yeah, so as you see, I'm posting here with my other fingers and I'm just sliding right in from here. So this is the basic motion for freehand needling, all right? And from here, you can practice all your different manipulations. You can practice lifting and thrusting, or sparrow pecking, some people call it. You can practice twirling, like so. You can rotate one way, rotate the other way. And I really just want you all to get a sense of what you're feeling through the needle here. Even in inanimate tissue, like the material of this bolster here, I can feel different structural changes through the needle and different changes being brought about by my needling. So as I first come in, so when I come in here, I feel at first there's almost no resistance, and then as I get a little bit deeper here, right about to this step, I'm starting to feel some grab. I'm starting to feel something inside here sort of seizing around the needle. There's a little bit of tension here, okay? Obviously this is going to feel a little different from what you're going to feel in living tissue, in the living tissue of your patients, but you know, this is quite close, I would say. So from here, I'm gonna the first thing I think I want for y'all to think about is to just get a feel for where that point is, all right? So just insert the needle and find that place where you feel a little bit of something coming back at you. Some of you may feel it as a slight resistance. Some of you may feel it as something grabbing the needle. The classical description, of course, that's beautiful, that we all love, is the sensation like a worm biting a hook, all right? No, wait, the worm doesn't bite the hook. The fish bites the hook. You know what I'm talking about, all right? Yeah, so just get a feel for where that grabs onto the needle at first, okay? And then you can try different angles, like so. Come in obliquely, come in from the side, transverse oblique in the other direction. See? The main thing I want you to keep in mind as far as the hand and finger technique here is I want you to come to this with a sense of gentleness, okay? With a sense of lightness in your hands. You'll find that the more you try to muscle this, the more you try to power through this, the less facility and the more difficulty you're going to find that you have in getting the right depth, getting the right angle, and when you, as any body worker, massage therapist, manual therapist will tell you, when you go for more muscular effort, when you go for more muscular power, you have to pay for it in sensitivity, right? So the more muscular effort you use, the less tactile sensitivity you're going to have. And when you're working with a tool like the needle, which doesn't require force, right? The whole reason that we use the needle to stimulate the points and to get change in the channels, rather than using our fingers, our elbows, our knuckles, everything that Tim's going to teach you guys in Toi Na, is as a tool. You know, this is the equivalent of, like, you know, taking off a hubcap with a wrench versus, is that what you use to take off a hubcap? You can tell I have a very specialized set of knowledge here. Using a wrench to take off a hubcap as opposed to using your fingers to take off a hubcap, right? So there's really no need to be exerting lots of muscular effort here. This is a very, very fine instrument, all right? So the two skills, to sum up, that I want you to be developing here just at first are, I want you to just get used to inserting the needle in this way, getting it to pierce whatever medium you're using, without the needle bending, okay? So, and the way that I used to do this is I would sit there and, you know, be watching TV or whatever, or reading a book, doing my reading for school, very important, and I would be just kind of just doing this, all right? And as soon as one of my needles would bend, like so, here I've bent this guy, so that's not usable anymore, I would dispose of it, of course, properly in the biohazard sharps, and I would pick up another needle and go to town once again. And the way I could gauge my progress, here I'll show you a couple of different angles so you can see. The way I would gauge my progress is if I started noticing that I could do this for a lot longer without needing to pick up a new needle, all right? Just a couple of finer points on the body mechanics here, on the hand mechanics. You notice I'm not doing this, okay? I'm not doing this. Well, I guess you could do that, couldn't you? Yeah, you can stabilize this way. This is no problem. But for that initial insertion, could I do the initial insertion that way? No, not really, because I don't get enough retraction. Yeah. So, and these things will vary with hand shape, with finger length, with all that kind of stuff. But for me, I find it's comfortable to insert like this. So just keep the wrist in a neutral angle, in as neutral an angle as you can while doing this. So you don't want to be here. You know, if you do like this, if you do like this, if you do these kinds of things, that's over time, that's really going to increase your odds of dealing with like a carpal tunnel or with a tendonitis or, you know, other stuff that you're not going to want to have come your way when you're in a busy practice, all right? Because generally we don't get sick days. So yeah, just start with that. Just start with inserting the needle, seeing if you can get it into the medium without bending, and then just finding that place of resistance. That really what we're talking about is the qi, all right? You know, kind of all right. Now, I did, you know, though I did say we're using the 25 by 40s for this, you know, you can, of course, feel free to use a thicker needle if you find that easier. There's no shame in that, okay? You know, when I was coming up, they had us use a very, very thick gauge needle to begin with as a sort of training wheels, and then as our, yep, see I bent that one, so I'm going to switch to another one now. As we improved in our technique, we found we were able to move down in gauge and use something closer to a gauge that we would actually use in clinical practice, all right, which is more like this 25 by 40 gauge, 25 by 30 sometimes, but nothing really above that. But for now, for practice, feel free to use a thicker gauge, as that will create more steadiness to the needle, more stability, and decrease your odds of bending it, okay? So if you find that you're using a thin gauge like this and, you know, you're bending it all the time and you're not really getting much practice in before you have to switch, then there's absolutely no shame in switching to a thicker gauge, okay?